Hello everyone, welcome again to this lesson. The title of today's lesson is Introduction to Dental Health Education, and I am my humble self, Promise Ucheka, presenting today. The aim of today's lesson will be to introduce the concept of dental health education and to discuss the domains and the components of dental health education. So the objectives for today is to introduce the concept of health education and the domains of learning, to define dental health education, to introduce the principles of oral health promotion, and to introduce and define the causes of the common oral diseases. By the end of this session, the students should be able to define dental health education, define the common oral diseases, and discuss the principles of oral health promotion, among other things. A bit of an introduction for dental health education. Dental health education helps to develop an individual's attitude as well as encourages the acquisition of new skill. So now this is about education. Okay, so the reason for education and the use of education is that when someone is educated, then that individual is able to build an attitude as well as acquire new skill. Okay, so it's used like a thing that is used to upgrade a person. Now, education and learning is an essential part of every individual's life. So we learn every day, we keep learning. Some people have said that once you stop learning, you start dying. So learning is a lifelong process. Education is a lifelong process. Yes, when you're studying for a degree, there is a time frame that is put in place for you to be able to complete your degree and get your certificates. However, even after you've completed the degree, you continue to learn and you will keep learning all the days of your life. Education is very crucial for growth and development. Okay, for the growth, individual growth and individual development, communal growth and communal development, societal growth and societal development. Education is very important for all these things. Now, education requires the need for both the learner and the teacher to be committed to the process of learning. So what this means is that without commitment, education cannot happen effectively. Okay, both on the commitment on the part of the person providing the education and the part of the person receiving the education. There must be commitment on both sides. There needs to be a balance when it comes to commitment for education. For you to say that this education has happened, there needs to be commitment on one end and commitment on the other end. And it is important that the delivery of education is combined with the different domains of learning. So you put into consideration different domains of learning, making sure that every element of the domains of learning is represented when you design or you're trying to convey an education. Okay, it is very, very important. We will understand the different domains of learning as we progress in this session. So, talking about domains of learning, education domain, what are they? Okay, so these domains of learning originally, started the development process started in sometime around 1956, and the process developed. It continued to build and build and build on themselves until somewhere around 1972. So between 1956 and 1972, there was this massive this period of time when the domains of learning continued to develop. Okay, so the learning domains have now been grouped or classified into 3 major domains. So these classifications have been done by different people, and they bring it together to form what we have today as the domains of learning. So we have the cognitive domain, we have the affective domain, and the psychomotor domain. So it's important to have this in mind: the cognitive, the affective, and the psychomotor domain. We shall talk about what those means. The domains of learning. Now, the cognitive domain, what exactly is cognitive domain? So the cognitive domain, the aim of cognitive domain is to develop the mental skills and the acquisition of knowledge of the individual. Okay, the cognitive domain encompasses 6 categories or 6 elements. However, let me explain. Cognitive domain is about mental development of mental skills, cognition, ability to learn and be able to remember what you have learned. So through regular practice, through regular study, you can be able to build a bank of knowledge, of skills around what you have been studying. Okay, so the 6 components of cognitive domain that is comprised of knowledge, comprehension, application, analysis, synthesis, and evaluation. So now in cognitive domain, a person that is building this knowledge, these skills, must be able to have the knowledge of what it is they've been studying or learning or trading on, and then they must be able to comprehend it. So the ability to know, to learn, to comprehend, and also to apply the knowledge that the person have acquired, to analyze issues relating to what you have learned, and to be able to synthesize the evidence or the results of what you've got, and to evaluate the outcome. So these 6 elements all come together to form parts. They're all parts of cognitive domain. They come together to form the whole bulk of this cognitive domain. So what about the affective domain? The affective domain includes the feelings, the emotions, the attitudes of the individual. So these are things that are particular to the person that is learning. What is their feelings towards what they are learning? What is their emotions like? And what kind of attitude do they have towards the process of learning or towards the subject that they are learning? So these things play they play part in the person's ability to learn. Okay, so these are the things that need to play part, that need to be in place for a person to be able to learn. Okay, the categories of the affective domain includes, the receiving phenomena, responding to phenomena, valuing, organization, and characterization. Okay, how do you receive the phenomena that is being taught, that you're being educated on? How do you receive it? So this is about feelings, emotions, and attitude. How do you receive it? So if someone is teaching you things and it's not properly received, then you will not be able to remember, you will not be able to to develop new skills based on the phenomena that you have been taught. Okay, how do you respond to it? How do you value it? Okay, how do you organize all the information that you have in order to be able to make sense of it and to use the skills? Psychomotor domain. So the psychomotor domain includes utilizing motor skills. Motor skills, in motor skills we have the fine motor and the gross motor. That is the ability to use the hand and the ability to use the whole body. So the ability to coordinate your motor skills is important in learning. Okay, The subdomains for motor domain will include the perception, the set, guided response, and the mechanisms. So now we've seen a little bit about education. Now let's look at health education. So how does education relate to health? Or when education is tailored to health, what exactly does it mean? What should we be looking at when we are discussing health education? So the concept of health education comprises of consciously constructed opportunity for learning involving some forms of communication designed to improve health literacy. And this includes improving knowledge, developing life skills, which are conducive to the individual and community health. What this means is that health education should be intentional. Okay, it should be intentional. It should be properly constructed. The opportunity. So you intentionally create an opportunity for an individual or for a community to learn. Even though it is important to be ready to teach, to pass health information to people at every point in time, making every contact count. However, to have an adequate health education, you must intentionally create an opportunity. Now, health education is concerned with factors that are necessary to take action to improve health. So what this means is that when you prepare a health education for a group or for an individual or for a community of choice, now it has to be so you have to like you have to you're teaching them to be able to take action, to take positive actions that can improve their health. So we have like the positive actions that can improve health, and we have negative actions that can diminish or negatively impact on health. For example, smoking is a negative action that someone could take, and it will negatively impact their health. But an action to stop smoking will be a positive action that will be targeting to improve health. Now, another element of health education is that the health education should be designed in a way that it should be communicating health information. So you say it is health education. The information that you must be communicating will have to be information that is targeted on, that is health based and targeted on helping the learners to take actions to improve their health. And now another element of health education is that you have to design it in a way that it will foster motivation. There is no point teaching any group of people, giving them health information that does not motivate them. So you need to design a health education in a way that it should be motivational and also be able to help the learners to develop new skills that will help them to improve their health. And when this happens, what you will be targeting something that will be like your ultimate outcome will be to improve self-efficacy in the learners. Okay, the learners must be able to have a higher level of self-efficacy after that they have learned the health, after they have received the health education that you have prepared for them. So if you do a pre and post education assessment, they should be able to find a very big difference to say that this person who rated themselves low when it comes to self efficacy before the education should be able to rate themselves least something higher than what it was, so that you can know that this health education had been effective. So moving forward, health education includes the communication of information, I have said, information that concern underlying social, economic, and environmental conditions that impact on health. So, like I said earlier, health education must be intentionally constructed. So when you construct health education intentionally, then you'll be able to put into consideration some underlying social factors, underlying economic factors, environmental conditions that impact on health. So what are the social determinants of health that you need to communicate in your health education? These are the things that you will think about, you will design it, and make sure you're not leaving any stone unturned. Now, individual risk factors and risk behaviors should also be put into consideration when designing health education. So, like in some of the lessons we've talked about before, we've shown you things like common risk factor approach, so risk factors that are common to multiple diseases. Okay, and now there are health behaviors and health detrimental behavior. So you need to be able to put into consideration individual risk factors and risk behaviors that you find in individuals. So you design your health education in such a way that it will communicate that, in a way that it will explicitly communicate the difference and encourage people. Remember, we talk about motivation. So by the end of your health education, people, the audience, the learners must be able to must be motivated enough to adopt health behavior, or at least healthy behavior, and drop any health detrimental behavior that they have been carrying all along. And now when you do this, you should be able to, through the health education, facilitate the proper utilization of healthcare system. So during your health education, when you design health education, you should be able to signpost the learners to the appropriate place for their healthcare services. Okay, so one of the aims that you should have in mind when designing health education is that at the end of this education, people should be able to begin to use more of the health services than they were doing previously. So moving forward, health education involves communication of information. I've said this over and over again. Development of skills which demonstrates the political feasibilities and organizational possibilities of various forms of action to address social, economic, and environmental determinants of health. So this is more like a definition of what health education is. Okay, so this is what it involves. It involves communication of well-constructed health information, evidence-based health information, in order to help the learners develop skills. Okay, these skills should be able to demonstrate political feasibilities and organizational possibilities. So you look at the feasibility of using the skills and the possibilities in doing that as well. The aim is to tackle and address the social, economical, and environmental determinants of health. Okay, in this model, we have been talking about social determinants of health, causes of the causes of ill health. So those are the social determinants of health. We've talked about things like income, things like social gradient, things like stress, things like education, and even life course experiences. So these things are things that you put into consideration when designing health education. Then a little bit about health promotion. So this is a process of enabling people to increase control over and to improve their health. So for people to take control of their health, increase the control they already have over their health in order to improve their health. So any information, any activities that you're putting in place that is targeted at enabling people to increase the control they have over their life and over their health for the purpose, for the single purpose of improving on their health. That is actually what we mean by health promotion. So what are the 5 priority action areas for health promotion? It's a bit old. It was proposed at the Ottawa Charter, prominent Ottawa Charter that we've been hearing about. So this proposed some priority areas for health promotion, which include building healthy public policy, creating supportive environment for health, strengthening community action for health, developing personal skills. Okay, now these priority areas for health promotion, it means that when you are developing a health promotion or when you are carrying out health promotion activities, these are the areas that you should be targeting. You need to build healthy public policies. Okay, so that's what we call upstream and downstream intervention. So interventions that are targeted at building healthy public policies will be upstream intervention. Then you're creating supportive environment for health and strengthening the community action for health. Remember how we defined community dentistry in one of our modules, where we say it involves the collective action of the community. And all these things is geared towards helping the individual members of the community to build personal skills that can help them to develop their health. So, some of the principles of health promotion. So, health promotion involves the population as a whole in the context of their everyday life, instead of focusing on people at risk of a particular disease. So what this means is that you come to a community where there are a few people that are at risk of prostate cancer. So who are the people at risk of prostate cancer? You're talking about older men, say men over the age of 40. And with the increase in age, increases the risk of prostate cancer. And now, well, the people that are really at risk of prostate cancer might be those that are really old. So now you come to a community where you have so many other things, and then you are planning a health promotion focusing on prostate cancer. So if you have been allocated a minimum resources for that community, if you spend that money or the resources on prostate cancer, you will be disenfranchising a lot of people in the community, because even if you are taking men as a population, it is not all the men that will benefit from that. So health promotion activities should be designed in the context of everyday life of the people, the whole people in the community, instead of targeting those that are particularly at risk of a particular disease. So health promotion is directed towards the determinants of health, or the causes of ill health. Okay, from the definitions that we've done at the beginning of this module, we have been talking about the determinants of health. We've been talking about the causes of ill health. So health promotion, any health promotion activities that you are preparing in community dentistry should be geared towards those determinants of health which we have been talking about, and the causes of ill health. So this goes beyond the immediate signs and symptoms that the people are feeling, those that are already having a problem, or the immediate cause of the problem. So this goes beyond clinical causes of a problem. You're not targeting the clinical causes of a problem, you're actually targeting the root cause of the problem. Okay, so now health promotion combines diverse but complementary methods and approaches such as communication, we've talked about communication, education, legislation, fiscal measures, organizational changes, community development, and spontaneous local activities against health hazards. So the health promotion, a good health promotion activity or program should be able to combine different kinds of some of these of this measure. They should be able to complement each other in order to have a good health promotion. So further with the principles of health promotion, a well-constructed health promotion activity should aim at effective and concrete public participation, requiring development of problems defining and decision-making skills, both individually and as a group. Remember, in this model, we have been talking about identifying how to identify public health problems. So you need to be able to define what a particular problem of interest is. Okay, so health promotion activities should be focusing towards helping the public in the spirit of public participation to develop the skills that they need to be able to define their public health problems and make decisions on the skills that they need, both at the individual level and as a group, in order to tackle their health issues. So this is like community empowerment. Okay, you empower the communities by empowering the individuals in the community to take positive action or to take positive control of their health. Now, it constitutes activities in the health and social field and not a medical service. So now what this means is that health promotion is not focusing on treating diseases. Okay, this is not about someone has a disease or someone needs a surgery, you go to the clinic and you get a surgery appointment and you go into the theater, you have your surgery and you begin your recovery process. That is not what health promotion is concerned about. Health promotion is concerned about the health of the people outside like immediate medical needs. Okay, things that will help the people to adopt healthy lifestyle and be able to live longer and have a better quality of life. That is what health promotion is focusing about. So it's not mainly about clinical prevention or clinical treatment of diseases, but it is something that focuses on at the community level, at healthcare professional level, where people, it's like something that happens in the community. Okay, it's more like happening in the community. It's not a clinical thing. Now, if we try to relate these domains of learning back to dentistry and community dentistry, because this module is about community dentistry, so it's more like just the same thing that we've talked about in education, in health education. You could just bring that back into dental health education. So dental health education will be a well-structured professional dental health education which should take a holistic lesson approach. Okay, so you are taking a holistic lesson approach, an inclusive lesson approach developed by the teacher who is the trainee, in this case a dental professional, and it will require the inclusion and accommodation of all the three domains of learning. So what this means is that as a dental healthcare practitioner, before you begin to develop dental health education activities or lessons, you should be able to understand education, understand health education, and just apply that to dentistry. Okay, remember we talked about the three domains of learning: the cognitive, the affective, and the motor domain. So when you have a proper understanding of this, you'll be able to design a lesson that will encompass the cognitive, the affective, and the motor domains of learning. Okay, so a learning task that is developed with the appropriate diversity will help create a relatively well-structured educational experience. So what this means is that when you develop a learning activity that is well thought about, then you should be able to have taken into consideration the cognitive domain of learning, the affective domain, and the motor domains. You must have put those things into consideration so that you're preparing a learning experience, a learning activity that will be inclusive and encompassing of all the domains of learning, so that in one single learning experience, the learners will be able to put everything together. So a well-constructed dental health education should be able to meet several learning techniques and educational modalities. So the dental health education lesson should be structured with a considerable amount of diversity, okay, which will help engage the learners as well as create more neutral network that will keep the learners, that will help the learners, okay, will help them with recollection of the information that you have given and the recollection of the event. So what you are doing when you prepare dental health education is not just to teach, it's not just to talk, it's not just to do anything. It is to create an experience that can be remembered. You're creating an experience for the learners. That is why we emphasize that it must be well thought through. You have to be consciously or intentionally design a program. After you have studied and understood the domains of learning, you have understood the principles behind health education, the principle behind health promotion, you can be able to put all of those together under dental health education. But the experience of that learning must be something that can be remembered, either that the event is easy to remember or that the information that you are giving them is clear enough, is concise, is straightforward, is straight to the point, is something interesting that the learner can remember. That is how the learners will be able to learn. So they must be able to create an association between, try to look at the events in a way that they can associate it to something that they can remember. So having looked at the dental health education, which we have narrowed down or adapted from the health education. So one thing is this is just for you to think about, looking at health promotion that we have talked about now and just a few minutes ago. So I need you to, on your own, think about what will oral health promotion be. It's just a kind of doing a deduction. You have to deduce this oral health promotion from the health promotion that you have just learned. So, example of some oral diseases that you can look at when you're thinking about health promotion or health education. So some common oral diseases will include periodontal disease. So now when we're talking about health education, so let's say you are planning to prepare a health promotion activity concerning periodontal disease. And now in this case, you made a choice of your community, your audience, the population. You've gone through the process of arranging the meeting and everything, but you need to define periodontal disease. So how would you define periodontal disease to a group of people who, so let's take, for instance, you are going to a school. Who are the people that you expect to see in a school? Say this is an early year school. So you expect to see pupils that are probably between 5 years and 7 years or 9 years. And then you're going to see their teachers, their guidance, their carers. And because you need the consent of the parents, say in advance you've sent letters to the parents and they have acknowledged it and they are there on the day. So you see that you are having a mixed audience, and none of the members of this mixed audience is expected to be a dental practitioner. So how would you design a dental health education that will be beneficial to these members, to every member of this group that you have just formulated? How would you define periodontal disease to them? What would be your language? So periodontal disease is also known as gum disease, which is when the gum becomes inflamed or swollen and may bleed when you brush. So you want to define periodontal disease to a mixed audience of people that probably the brains are not so developed because they are kids, and then you're talking about their teachers who might understand English but not the professional jargons, and the parents who might or might not be learned. So what you do in this context is that you adopt a moderate definition, a definition that each member of your audience can relate with. So in terms of periodontal disease, what are the kind of language that they will relate with? Gum disease. Inflammation, when your gum swells up. Swelling, bleeding while brushing. So you use this kind of language to construct a definition that everybody can remember and relate with. So in teaching them, you have to be able to teach them, breaking it down in stages, letting them understand the difference between gingivitis and periodontitis, and that gingivitis is the reversible form of periodontal disease or the gum disease, while periodontitis is the advanced form of gum disease, which is not reversible. So now, if periodontitis is not treated, you need to let them know that untreated gingivitis will lead to periodontitis, and untreated periodontitis will lead to something like bone loss, or you might lose the teeth as well. So you need to let them understand the sequence of progression, and you must do this in a language that can be understood by every member of the audience, putting into consideration the domains of learning that you have learned previously, because the intention is that when you have learned about learning, about the domains of learning, how they work and how they come together. That will help you to design a well-constructed health education or dental health education that will be broadly accepted by the audience, even though you have a mixed audience. So now I've given you a definition of periodontal disease where we use the most common, terminologies like gum, swelling, bleeding when you are brushing and all that. So what about standing before such a mixed audience and you tell them that you want to talk to them today about periodontal disease and they are looking at you like, what is periodontal disease? And you say, yes, okay, by definition, periodontal disease is chronic inflammatory disease of bacterial etiology that affects the tooth supporting soft and hard tissue. They will not have a clue what you're talking about because you're using professional jargons. They're not your classmates. They are not your professional mates. They are not in the same field as you are. And some of them are kids. Remember, we are using example of a school for early years school where you have their parents to, where you have their parents and you also have their teachers and the children as well. So you have a mixed audience. You have to use a language that everybody can relate with. So when you're looking at the scientific definition of periodontal disease, the clinical definition of periodontal disease, and how it is characterized by persistent inflammatory connective tissue breakdown and alveolar bone destruction, this definition is for you. For you who is the clinician, for you who is the person in community dentistry, for you to learn and remember or know and understand what periodontal disease is professionally. However, the moment you are facing an audience, what you should be talking about is using a language that they can understand to define the disease. So what about dental caries? There are languages, there are terminologies that you can actually use to make them understand that dental caries is the same thing as tooth decay. So if they are confused by the professional name caries, so you have to make them understand it is tooth decay you're talking about. It is dental decay, as some people might call it. And in other places, they may have other names that they use to relate with this disease. And then you explain to them that the dental caries occurs when bacteria break down the sugar in the mouth, and this produces acid which removes the enamels, which removes the minerals from the outer layer of the teeth, which is the enamel. So when you use a watered down definition like this, you will be able to get the attention of the audience. So just to show you the social determinants of health, like we mentioned before, I'll try to keep bringing these things up in this lectures so that it's just to keep refreshing your memory. So the social determinants of health, or the causes of ill health. So you have the factors that play important role here. If you look at the base here, excuse me. If you look at the base here, you see factors like age, like sex, like constitutional factors, and then you have individual lifestyle factors. This is where you have health behaviors or health detrimental behaviors of the individual. So these are factors that you might not be able to change. Factors like your age, you might not be able to change it. Factors like your sex or your gender, you might not be able to change it. But also, but here, over that, you have a choice to make when it comes to individual lifestyle factors. So these are areas where you can make decisions. Okay, so this next layer is about your social and community network. They all have an impact to play on your general health outcome or your oral health outcome. And that continues. So I will also encourage you to take a look at this book, the Solid Facts. This will introduce you to the social determinants of health. So some of the social determinants of health that we'll be talking about here and in the lessons that we'll be having subsequently will include social gradient. I've mentioned these things before. Early life experiences or encounters, the kind of work that a person does, the social support that is available to them, and the food security. So I've said, I believe it was in a previous class that I said that it's not just about encouraging the patients to eat healthy food, but you also need to understand and show empathy when it comes to what food is available to them, because not that people do not know what to eat, but they may not have access to that, so their food security might be very low. So other factors, other social determinant factors could include addiction. What are they addicted to? Are they addicted to smoking, to alcohol consumption, or to whatever it is they are addicted to? Unemployment, their social exclusion, stress also, and transportation, access to. There are a lot of things. This is just a few things that I've chosen to mention now, but there are a lot of other social determinants of health. So social determinants of health, they have direct impact on health. We've said that they have impact on health, so they impact on the causes of ill health. So that is why we refer to them as the causes of the causes. They are like the underlying factors that lead to the causes of ill health. So social determinants predict the greatest proportion of health status variances. So the variation in health status of individuals also determined by the social determinants of health. So the things that underline the decisions that an individual will make, just like we've said, things like your income, your education, your work pattern, the kind of job you do as well, and so many other factors. Okay, so social determinants of health is structured around health behavior. I've said that in the just previously, and the determinants of health interact with each other in order to influence health. So now we are looking at, remember I've been talking about common risk factor approach. So you see one determinant of health might be interacting with up to 3 to 4 separate diseases. So I did mention something that are called the upstream and the downstream intervention. So in community dentistry, when you are planning an outreach or a health education or any form of intervention, you should be able to know whether your intervention is targeting at the upstream or the downstream. So the health interventions that target the upstream, or the things we call upstream intervention, are those that target like the national policy making initiatives, okay, whether it is national or regional, but as long as it's targeting policies, it's targeting the government, it's targeting things that are beyond individuals' ability to handle, it becomes upstream intervention. However, if your intervention is something that is focusing on things like clinical prevention and say school dental health, where you go physically and you're speaking to students and you are not effecting like a long-lasting change that would probably come through legislation, so that would be a downstream intervention.